time. Okay?
Okay, thank you, Mr. Chairman. Mr. Chairman, ladies and gentlemen, dear colleagues, it's a pleasure for me to be here and to share our findings with you. I want to talk about recurrent mastitis, about a real simple question: is it a persistent or new infection? The story behind is, as Peter Edmondson showed, in the last years, many farms improved due to subclinical udder health. So we have more healthy cows in the herds. The pathogens are changing a bit to the environmental side. And for my consultant works, it follows that clinical mastitis becomes more and more important because due to animal welfare reasons, because of the use of antibiotics, and because of interrupting the routine in the farm. And when we calculate the clinical mastitis cases in our farm, we are finding in many farms that recurrent cases are more important than or have a higher number, a higher percentage than the first cases in the farm. So then you are searching for solutions and consequences, what to do with these cases, what is the cause of these cases, and then very fast you are ending in the question, is it a persistent infection? And I think most of all here in the room learned in the vet school that recurrent mastitis is normally a persistent infection, or is it a new infection? And we made a small trial to answer this, and yeah, I'm happy to share. First of all, let me give a definition about recurrent mastitis, and if you look in the publications about that, you will find that there is no clear definition. It is more or less like the occurrence of mastitis after a previous mastitis within one lactation with a time interval, and now it changes or it splits in different possibilities, more than 3, more than 5, more than 7, or more than 14 days after the first case, and depending on the farms and on the documentation on the farms, based on cow or quarter level. So I think in most papers in the last years, 14 days is the normal time period from the first case before the time for recurrent cases starts, and quarter level, of course, is the best option. Ente Schücken published some years ago a very nice scheme to analyze clinical mastitis situation on a farm, and if you have too many clinical mastitis cases, and he gave the threshold of 2% of the cows per month, then you go as the next step to check, do you have more first cases or do you have more recurrent cases in the herds? And as I said, in many of the herds I work with, they have more recurrent cases than first cases. And then he said, okay, if it's a recurrent case, what you have to do, you have to check, was the diagnosis really correct? Is your treatment protocol okay? Or are the culling protocols okay? So it is very much focused on treatment and culling. So that means at the end, behind that is the thinking that a recurrent case is a persistent infection. And that means you treated the case, but you reached not a bacteriological cure, maybe because of the situation that you was not able to reach the MIC in the tissue. Possible risk factors for that are that bacteria are able to form biofilms, they grow intracellular, they are protected by connective tissue, or they have a special resistance genetically. And the measures you can do is to cull them, to introduce resistance testing on a higher level to figure it out more earlier, to treat them prolonged, or increase the doses, or add some concomitant therapy. If it is a new infection, the cause is probably a little bit different. If it is a new infection, it means more that the damage of the first case will increase the chance for a new settlement of bacteria onto the tissue. So the risk factors are first cases and infection pressure on the other hand. And the measures you can do to change it, you can reduce the rate of new infection, so you can bring the infectious pressure down, or you can treat the first case more extensively, not on the view of bacteriological cure, but on the view of reduce the damage in the tissue. Okay. So we made a small study. We used a convenience sample of 3 farms, and we checked all clinical mastitis cases from the years 2011 to 2015. We took quarter milk samples from all clinical cases, sampled and diagnosed them according to the NMC guidelines, and we took all the isolates from farm, quarter, and cow, and wherever we found the same pathogen in the first mastitis and in the second mastitis case, we used strain typing to compare these both strains to figure out if it is the same strain or another strain. Because the story is simple, if you have a clinical case of mastitis and you find, for example, Streptococcus uberis, and then you have a next case, a recurrent case of mastitis, and then you find Staph aureus, then it's clear it must be a new infection. But if you have, in the first case, Strep uberis, and in the second case, Strep uberis, this could be a persistent infection, but also a new infection. It depends on the strain. And so to clear this, we used rapid PCR, randomly amplified polymorphic DNA. It's a very simple and relatively cheap method. Maybe it's not the method for the highest scientific level, but it's easy to do it in a regular base, also in regular samples from normal farms. Okay. Just to give you an idea how it looks like, what you do at the end, you compare electrophoretic bands. Here you see the outcomes of 4 cows, Almut, Bertha, Lotta, and Elsa, and you see always the first mastitis isolate and the second mastitis isolate, and you see for Almut, Bertha, and Elsa, the electrophoretic band is the same for both cases, so that means it is a persistent infection. But for Lotta, you see there is another phoretic band in the second case than in the first one, so it is a new infection. So really simple story. Here you see the distribution of isolates of the first cases and the recurrent cases, and you see it looks really similar. The only thing you can say is that you have in recurrent cases a little bit more Strep uberis and a little bit more Staph aureus, but the normal distribution is more or less the same. So let's come to the real results. We had in these years from 2011 to 2015 roughly 2,380 mastitis cases, 1,160 first cases, and 1,220 recurrent cases. As I said, we have more problems with recurrent cases than with first cases. And from these 1,200 recurrent cases, we had in 190 cases the same pathogen in both or in the samples. So that means at that moment we have 85% new infections and 15% persistent infections. And then we compared the strains, and we found at the end only in 51 case combinations of the same strain in the first case and in the second or third and so on case. So that means from 100% recurrent cases, 95% are new infections, and a bit more than 4% are persistent infections. And maybe that changes a little bit my picture of the mastitis world, and it ends in changing also the things you can recommend in the farm. Some words about discussion. From the diagnostic point, it is also possible that you have in a farm a very dominant strain of Strep uberis, for example, and therefore, if you have the same strain in the first case and in the second case could also be a new infection. You never know. That means probably the number of new infections is higher than these 95%. On the other hand, you have in some samples multiple strains. You normally pick not all strains you find in the sample from the plate and check these So there is a risk that you check the wrong strain. So there is also a risk that the figures at the end, or the numbers at the end, are not correct. So to come to a conclusion, for me, it means that we have some farms with many recurrent clinical mastitis cases, where 95% of recurrent mastitis cases are new infections. And we saw that rapid PCR is helpful to identify the causes. And that brings us to the recommendation that new infection prevention in the farm is more important than treatment, especially for these recurrent cases. Ladies and gentlemen, thank you very much for your attention.